My name is Taggart. I'm from an organisation known as P.I.P.S. And P.I.P.S stands for the Public Initiative for the Prevention of Suicide and Self-Harm. And the name P.I.P.S came from one of the young men who actually died by suicide. He took his life 10 years ago this year, and his friends called him P.I.P. And the reason why we chose the name P.I.P.S was because we wanted a name that represented people, that represented our young people, because at that time when Philip died, he was the first of 14 young people, all under the age of 18, one of them being a young girl who died by taking her own life. Without even knowing, we can transfer that trauma that we have came through onto our children. And Breed said to me, when she was talking about her son, her young son, she says, "Not on my watch." And I just thought, that was fantastic, that there is a way, maybe, to stop us, unknown, transferring our trauma onto our loved ones.
Within a culture that does not want to talk about depression or despair or hopelessness. Doc, don't talk to me about that. I'm not crazy. And I'm thinking, yes, but you're depressed, and you're confused, and you're hopeless, and if I'm not mistaken, you're probably suicidal. So I talk to my people, the people that I work with, the people I identify with, about their resilience, about what they have. And then I talk about, well, what the researchers call protective factors. Those things in our life that will bolster that resilience, strengthen it, lift it up, make it stronger. And then I talk to them about what their researchers call risk factors. Those things that will wear it down, that will take away from resilience.
Trauma affects all human beings physiologically in exactly the same way. It affects the body, the central nervous system, in ways that affect every level of the human body. And when we can't work with the trauma, that situation becomes frozen in the system. And the freeze is what brings people to doctors. When people die from suicide, often people will say they were in despair. Yes, they were, but that's not where it started. There was something in the inability to express that need for fight and flight and that anger energy that couldn't be accessed for whatever reason. Maybe, the person was too strong, or you didn't know who you were angry at, or you were angry at the state and couldn't do anything about it, or whatever. But there was no way to access it, and so the system closes down. And when the system closes down, the adrenaline is still pumping. Still pumping. And people don't know what to do with this level of distress. So often, when someone dies from suicide, it is an attempt to manage this state of affairs. It is an attempt to manage it. It's a last-ditch attempt to manage it. We can do a lot as parents, huge amount as parents, to reverse that process, to change it, to help our children to live more healthily. But we need to know what to do. And as parents, we're often told either we should know it all because after all, we're parents, or what would you know about it? You're only a parent. So you're kind of between the devil and the deep blue sea. But it's my firm belief that in order to support our children, not to the 5th generation, but to support our children to engage with life in a healthier way, we need to know about trauma for ourselves. We need to know what has happened to us. And we need to learn about how that transmits itself into the next generation of children who haven't directly experienced what we experienced.
This sincerely as a public health service to your people and my people and people throughout the globe. We do need to understand the trauma of our lives and how that can sometimes destroy lives and destroy the generations and the generations, but how that also can come to transform lives, as Jim was alluding to and talking about. How our souls and our very beings and what it means to be human can actually be transformed through horrible, horrible times and conflicts.
Suicide Awareness Support Group has been my strength over this past 12 years. My mummy calls it our sanity. It's like a wee haven on a Tuesday night. Sometimes you go down, you walk by and you wouldn't think it was a suicide group because of the laughter. Because they formed, it's like a wee family that they formed together. And without it, my mummy would be lost. We have struggled this past 5 months, but we've turned the corner, and it's about working together in partnership and looking forward to the future and what can we offer our community, how can we empower them. And the only way that I can say, if I was sitting in that audience today and I was worried about somebody suicidal, I would go and find out the information. Where do you go and get educated? Who knows the stuff? Organisations like Suicide Awareness, P.I.P.S, Féile, everywhere in Belfast knows somebody who delivers training. Whether it's only a small talk you want, or you want a 2-day workshop. You know, the talk, the T, the A, the M, the K, it's very basic. Tell somebody that you're feeling suicide. How do you ask the question? Everybody thinks, if I ask that question, I'm going to put the thought into their head. That's a myth. That's not true. Listening is an organ. If you have somebody that's going to listen to you, it's a big weight off your shoulders. And I always say, once that person comes in through that door, that's the first step. That's the hardest step. After that, the process is just, what resources have we got? What needs do you need? How can we meet them? And see, when you see the people coming, you always hear about the deaths. You don't really hear about the ones that survive. And I just wish people, it's very hard to sit up here and talk about, it's very painful. But as people like me get that message out that life is worth living, life can be good. My wee girl's 17 now, my wee boy's 14, and I just look at them and go, that's what I would have missed out on. So please reach out and ask for help. The stigma and the taboo is only us going out and providing the training to let people know that everybody out there, whether it's 10 years ago, 10 years from now, we'll all be touched by suicide. And I would just like to thank you all for taking the time to listen to me.